I can't give you ducky lips. And part of my consent is like, if you really want ducky lips, I'm not your girl, because it's not something I'm comfortable with. This is Med Spa Mayhem, the podcast all about the chaotic world of medical aesthetics. From Botox to lasers to IV bars, learn how to tell real versus fake, legal versus illegal, and safe versus potentially deadly. Hear the crazy stories inside the med spa world and find out what questions to ask and how to spot the people cutting corners. I'm your host, Dr. Kate Dee. Together, we explore the wild west of medicine that is the aesthetics industry. Today, Dr. Des Otto and I fill you in on everything you ever wanted to know about lip filler, but were afraid to ask. Stay with us and we'll cover the good, the bad, and the ducky of lip injections. Hi, this is Dr. Kate Dee, and I'm back today to talk about lip filler with my partner, Dr. Desiree Otto. Dr. Otto went to University of Washington Medical School and then did an OB-GYN residency at the University of Washington and has been a practicing obstetrics and gynecology doctor in Seattle's East Side and Bellevue for the last 20 years. And then she transitioned over into aesthetics about 6 years ago, and she is my partner at Glow Medi Spa, and she owns and runs the spa that we have in Kirkland, Washington. Thank you so much for being here today, Des.
Thank you so much for having me. I'm so excited to participate in this. This is great.
I know. I've been really looking forward to having you on the podcast. I know that you wanted to talk about lip filler because it's a passion of yours. So that's what we're talking about today. Okay, so a lot of people in our audience might think, oh, everyone has lip filler nowadays. So can you tell me why people come into your spa asking for lip filler?
Well, some people just want lips just to be a little bit larger, a little bit fuller. A lot of patients will have a slight asymmetry, like perhaps their upper lip is a little bit smaller than their lower lip, so they want that just enhanced a little bit so there's a better ratio. And as we get older, a lot of times we lose volume throughout our face, and the lips is one of those places. So we can develop lip lines or just volume loss. And so sometimes just replacing that a little bit, making the lips look a little bit more fresh and plump.
Yeah, so as we get older, one of the big things that happens is we lose volume in our lips. Like, it's actually quite noticeable. Once you start noticing that, you really can't not see it. So, you can have people where it used to be that they had nice full lips, and as they got older, it just becomes thinner and thinner. And some people, kind of don't even have lips anymore. They kind of look like a Muppet sometimes, but, except the Muppets where they draw on the lips, but usually Muppets don't have any lips at all.
Muppet, totally.
Right.
Totally. Right.
So some people, they've aged and they want their lips back, like the lips that they used to have. And then other people, they have, their regular lips that they like, but it's never been very full, and they'd like to be fuller and just feel like they have fuller lips and that they really never did achieve when they were younger. And then there's people who just are young, and everybody's really wanting very full lips nowadays. A lot of 20-somethings and 30-somethings seem to want like really big lips, or at least a subset of people really want bigger lips. I think that Kylie Jenner made lip filler pretty famous because for years she was posting these giant lips. I do think that Kylie Jenner, I think she very famously also stopped using it and posted that she's no longer doing that. Is that?
That's true.
Yeah, but I've definitely had over the years, younger women coming in saying they want Kylie Jenner lips. Do you ever have someone name Kylie as their goal?
Not specifically, but definitely wanting the fuller lips for sure. Young women that already have pretty full lips wanting even more for sure.
Yeah. I wanted to talk about like that sort of overfilled ducky lip thing that seems to happen out there. Have you seen a lot of people walking around on the east side of the Seattle area with ducky lips?
I think that's something you see quite a bit of. I don't feel like in my practice, most of my patients don't want that. Most of my patients really want a natural look. And in fact, I think they're fearful of the ducky lip look. And in fact, their partners are fearful of that as well.
Right. God forbid, don't go in there because you'll come out looking like a duck. That's been my experience too. I think for sure in the Pacific Northwest where we live, people really want to look natural. So they want to have that fuller lip, but not look weird and not look like they had something done. And I think avoiding that ducky look is, to me, just crucially important. I can't imagine having somebody walk around like that and have, their friend say, "Oh my, wow, your lips look amazing. Who did that to you?" And the last thing I want to hear somebody say is, "Oh, that was Dr. D." Like frightening to me. But I definitely think that having that really big ducky look seems to be very popular in some areas of the country. You certainly see it on television a fair amount. How do you avoid giving somebody a ducky lip? Why do you think people get ducky lips or overfilled, and how do you avoid that?
Well, again, I don't encounter this too much, but I think there's times when you just have to say no, or that getting more filler isn't the answer. I think certainly just putting too much in there is part of the problem. And maybe trying to achieve too much in one sitting, because there is a limit to how much volume you can put in the lips. And once you've reached that point, it's going to start migrating up into the white part of your lip, which you don't want to start looking all thick. And that's where it starts to really look bad.
Yeah, filler can migrate from the place you put it. So you can put it in the lip where it looks good, and then over time it could migrate up and just make your upper lip look too thick and stick out in a weird way. So that's unpleasant. I find that the ducky thing is just, I think, from just overfilling, and someone wants, more. And I think I agree with you, like to do a smaller amount at first. I never use more than one syringe at one time, never. And if they really, really want more, that would be added to at a later time when it's settled in. I guess now is a really good time to talk about what happens when you inject filler into the lips. Because so first of all, we numb the lips with a topical anesthetic, and which works really well on the lips because there's such strong blood flow to the lips that it gets absorbed really well, and so you go numb pretty quickly. And then we place the filler in pretty close to the surface, so in the pink part of your lip, and not too deep. So there's a important artery in there that you don't want to go too deep and hit that. So we stay very close to the surface, and we put it in there. And if you put too much, it will swell up the vermilion border. So the vermilion border is the edge between the pink part and the flesh colored part adjacent to the lip. And when you put too much and it swells up, then it gets that ducky look because there's basically an attachment point at the vermilion border. And so that swells up and looks very strange. Now, the one thing that will happen for sure is it will swell. And the next day, so it might be a little swollen when you leave, but the next day will be the peak swelling and it will be bigger. And you will either love it or you will hate it. If you love it, then a couple days later, the swelling will be gone and you're going to want more. If you hate it, don't worry, because a couple days later, the swelling will be gone and it will look okay again. But there's definitely that kind of roller coaster of swelling that happens no matter how you slice it. Now, some fillers swell up more than others, and I very much like a filler that doesn't swell as much, so that's kind of nice. It doesn't freak people out nearly as much. But some fillers swell quite a bit, and that's just normal. That's going to happen. I wanted to address, do you think, does it hurt? And does the topical anesthetic work? And how have you found that to be for your patients?
The topical anesthetic does work, so you definitely feel very numb, but it it's still uncomfortable, I will say, for most of my patients. It's totally worth it, but it's not a painless treatment.
Yeah, I would say especially the first time you have it. There is not only the topical that we put on your lips, but there is anesthetic inside the filler itself. And so once you've had some injections in the upper and lower, your lips are super crazy numb. And people tend to not be bothered by it that much after that. But in the first few injections, it can be quite uncomfortable, despite the fact that we've used a topical.
It's a very sensitive area.
Yeah, so. It is. Most people, though, after the first time they do it, don't seem to mind it very much. I think that you're placing it into a plane right beneath the surface of the lip that had filler in it before, and now there's either you're putting it in a plane that already has some filler, or the patient's numb there. I'm not really sure. Do you have an idea of why that doesn't hurt so much on the second time around?
Not sure. And maybe it's also just knowing how good it's going to look, because I think we're much, true though, I think we're much, if I'm going to go through something painful and I'm getting something really great at the end, it's way better than other medical procedures, right? The reward is worth it. So.
It's true. People do really love it. I mean, I had one patient who had very little lip left at the time she came in. She was pretty reluctant to do anything really, but she's just like, I just want some lips to put lipstick on. And we did. And we gave her not a ton, and it looked really great. Just plumped them up just a little bit. And now she had lips, and she had gone years without really having any lip to speak of. And so when you really love the outcome, it definitely makes it like totally worth it. I do think it's important to tell people that, yes, the first time definitely can be a little bit painful, but it is also very, very quick procedure. I mean, we book more time than this, but really for me, it really only takes a few minutes to inject lips. I mean, it's an art, and we might go back and forth side to side to make it symmetric and everything, but it's a very quick procedure.
Right.
Are there people that you won't do for lips? Like, is anybody come in who's too young? What's too young for you?
Well, I think usually I try to wait till someone is 21, just because that's the FDA approval for the lip filler.
Yeah.
I've definitely had people on the border of that, or people that have had it that were 20 and have already had it several times. So obviously, people are doing it, outside of that window.
Yeah, I try to also stick to that as well. We can do things off label in somebody younger, but I also think that if you can't legally drink, then making this decision is a really bigger decision than having a beer or something. So I kind of think that maybe it makes sense to wait till 21. Although, to get a tattoo, you just have to be 18.
Right.
So maybe.
Yes.
So, and that's a bigger, I don't know, what's a bigger decision? This will at least go away. So I can guarantee you the lips are very well perfused, meaning they get a lot of blood flow. And any part of your body that gets a lot of blood flow, the filler will last less length of time. So if there's not a lot of blood flow, like cheeks near the bone of your cheeks that enhance your cheeks, that lasts kind of a long time. But in the lips, it doesn't last as long. I think we see on average maybe 6 to 8 months, and people want to do it again.
Well, and you're moving your lips all the time as well. All that massaging that just happens with speaking.
Just speaking and using your lips, in normal daily activities. Yeah. Right. So anytime where you're going to move it, use it, and it has more blood flow for sure, the filler won't last as long. Well, let's go back to this for a second. I'm going to pause. What about other people who maybe shouldn't do it? I find that, so besides people who ask for too much, and I just think I can't do that. I can't give you ducky lips. And part of my consent is like, if you really want ducky lips, I'm not your girl, because it's not something I'm comfortable with.
Right.
I think the big thing for me also is when they want a different shape. Like I've had people ask for Betty Boop lips. Have you ever had someone ask for that?
Not specifically, but I know what you're talking about. Yeah.
Yeah, and
Yeah.
I think one important thing to relay to people is we really can't change the shape very much, and certainly not for any length of time. You know, your lips are the way they are. You can make them a little plumper, and you can add more to the middle than to the sides.
Absolutely.
Um, but that doesn't really long term because the lips are mushy and the filler that we use for lips is mushy the way lips should be. You can't really mold this stuff into a new shape and give you a new shape. You really, I don't think that that's possible. And I think that the important thing is making sure that people have reasonable expectations so they understand what we can and can't do, in order to know like that we're doing the right thing for them. Because if they think we're doing one thing and we're like, well, you know, that doesn't really, that's not how this works, then they're going to just not be happy.
Right. Yeah. Some things aren't possible. And some people with little tiny lips, just their anatomy, because of their anatomy, there's no way to give them Kylie Jenner lips. It's just, even if we try time and time again, it's just never going to happen. So they need to have a realistic expectation.
Yeah. So I would definitely say having realistic expectations. I also think one thing I learned a long time ago, I'm sure you did as well, is this ideal lip ratio.
Right.
Your lower lip's supposed to be a little bigger than your upper lip, and the ideal ratio is 1 to 1.6. Okay, so not an insignificant difference, right? The upper lip's not supposed to be the same size as the lower lip. It's supposed to be smaller. And I definitely have had people wanting just like a really big upper lip. And I think that looks so bizarre. I really have trouble working with people who really want them to be even or the upper one to be so big. Like they're so focused on their upper lip that they don't realize that their lower lip needs to be a little bigger. Otherwise, they're going to look super bizarre. And I do explain that to people. And then they realize it. They realize, oh, you know, I've been staring at my upper lip feeling like it's too small. They're thinking, oh, they're going to save money by like just injecting a little bit in their upper lip. I'm like, well, if we make your upper lip bigger, we have to make the lower lip bigger too. Otherwise, you're going to look super odd.
Right.
But
Although,
I think,
although some people can pull that off, the even ratio and even the asymmetry. But yes, typically 1 to 1.6 is the goal.
yeah, well, and again, everything is, you know, one's idea of what beauty is, but pulling it off in my mind means you're gorgeous everywhere else. Nobody's staring at the fact that your lips are the wrong ratio, but I could be wrong about that. We can restore some shape to the lip, like people have what we call pillows in the lip, and we can restore those, and the philtrum, which is the two lines above your lip that kind of attach your lip to your nose. Some people that kind of dissolves away over time. You can't really see that they have that shape. We can restore that also with filler. The thing about that is it doesn't last, you know, for a really long time, and that will dissolve away as well. But we can restore that to some degree, and it can look very, very pretty. So what fillers do you use? What are your favorite fillers for lips?
Well, my most favorite filler for lips is Restylane Kiss, which is specifically made for lips, and it works great. It's just the right amount of plumpness, but it's also flexible.
Yeah, so Restylane Kiss, for our listeners, is a flexible filler. So one of the companies, Galderma, makes Restylane and that family of fillers, and they make several that are flexible. So they kind of move. That the analogy I usually tell people is that most filler is pretty stiff, and it kind of holds its shape. Whereas flexible filler will bend when you move it, like kind of like a Gumby doll. So you can bend a Gumby doll and it bends around, and it springs back to the shape that it was before after it's been bent. And so it looks really natural, and it really looks good in the lower face, and the half of your face that's always moving. It looks really good. So I also prefer those fillers, especially for the lips and lower face. I also like Refine for lips because I have treated a lot of patients kind of our age and older who've lost volume. So both Des and I are in our 50s. So, and I can tell you most of us don't want a ton of volume, right? We want like just a little bit. We just want to know that it's a little plumped out. And so I like Restylane Refine for people like us. And then I like Kiss for people who really need volumizing, as opposed to just a small amount of plumping. I also like Refine because it's the softest filler you can get. So it's very soft and silky like lips are. Kiss is great. It's a little firmer than Refine, but I think it works really great, and it's meant for lips. There are some older fillers that are still used a ton for lips. They're not my preferred, but Juvederm Ultra and Juvederm Ultra Plus are used for lips all over the country still. There's nothing wrong with that. They do tend to be a little more lumpy than Kiss or Refine. The other is the older Restylane. Restylane L was originally used a lot for lips. But that's very similar to the Juvederm ones. It's just a little stiff. It's a little lumpy, so it's not my favorite, but there's nothing wrong with using those. I do have an issue with any of the non-resorbable permanent fillers. So I don't think I don't think they should be used for anything, but especially not lips. So no Bellafill and no Radiesse ever, never. Is that I assume you agree with that?
Yes, I agree. Yeah. You don't use Sculptra around the lips either. Yeah.
Yeah. Well, so those other ones, so the fillers we use in our practice are all hyaluronic acid fillers. And we've talked about those in the past on this podcast, but basically those are made out of a natural substance that's in all your joints, and your body, doesn't have a problem with hyaluronic acid. It's a normal part of your body, but it does slowly get broken down by your body over time. And that's why filler doesn't last. But the advantage of it is your body doesn't think it's foreign and try to wall it off or get rid of it. There's also an enzyme called hyaluronidase that can break it down. So if you have any issue with the filler that you want to get rid of it, or there's a lump or some issue, or God forbid a vascular occlusion, you can actually treat that and get rid of the filler. Whereas with Radiesse and with Bellafill, there's nothing you can do. If you don't like it, you're stuck with it. It's permanent. It's lumpy. God forbid you have an occlusion. It's not treatable. So we only use HA fillers. The one I will also mention is just Bellatero. I don't have Bellatero in my office, but it is also very soft and silky. And the reason I don't have Bellatero is it doesn't really last very long. So it's not my choice, but that's not an unreasonable filler to use for lips. At least it's safe. So what about things that can go wrong with filler? You want to, mention some of those?
Sure. Well, I could mention, I think we mentioned swelling, and this is not, swelling is a natural side effect of getting the filler, and that's just going to be transient. The other thing that commonly happens is a little bit of bruising, so I guess people should know that as well, that since the lips are very vascular, sometimes you can get bruising, and those are really not really complications per se, but just sort of part of the healing process. Right?
Yeah, somewhat expected. I will say that bruises in the lips heal really fast because lips are so well perfused that also means they heal really fast. So bruising tends to not last a long time.
Right. And then getting into things, I think we touched on migration, which we can address later. And then the thing that I think as injectors we're most aware of and most concerned about would be a vascular occlusion.
Yeah. So I mentioned earlier that there's a little artery that is about 3 millimeters deep. So not very deep, but if you were to get any of the filler into the artery, you could block that and therefore block the blood flow to your lip. And where that ends up is right in the middle. The ones I've seen have mostly been in the upper lip, but you can get it in the lower lip as well. And what happens is you get this necrosis, meaning death of the tissue right in the middle of your lip. So right in the center, and that will turn black and hopefully will heal, but you can end up with scarring there. So really just we are so anal and careful about avoiding that artery, and you have to know where it is and how to avoid it. Again, every time I talk about this, I knock on wood, like, thank goodness this has not happened in my office in 10 years, but we are very well aware that that could happen, and we know the anatomy, and then we also have a whole fridge full of hyaluronics to treat it. God forbid we had to treat that. But to me, that comes up as a really big reason of, why it matters who's injecting your lips. Because the person who doesn't know any anatomy or doesn't understand what a giant risk this is, or, doesn't have that enzyme in their fridge and is able to treat this, they don't know what they don't know. And it's a huge risk. And here you are going to try to enhance your appearance, and instead you can end up with really, really ugly scarring right in the middle of your face. So that is a really big one. I think the other thing that you didn't mention is so lumpiness is pretty common, especially with those other fillers, the older, stiffer ones. Occasionally you might have a lump or an asymmetry that you just don't like, and you need to dissolve that to make it look and feel more normal. That can happen. There's also this I've had this happen once a long time ago when a different filler was introduced for lips, and that was called Volbella. And so Allergan makes some fillers that are called Vicross fillers, and they last longer supposedly, but they also are much harder to dissolve. And some people can get these weird chronic nodular reactions to them. So you can get late inflammatory nodules, meaning, you got the lips a year ago and you loved them and they were great. And then they slowly faded away and you haven't thought about it. And now a year later, you get these lumps that suddenly pop up and they're really inflamed. And that can be really very, very difficult to get rid of. And I don't understand. I stopped using that filler a long, long time ago because of that. But you need to make sure. I would not have Volbella in my lips ever. It was it was very soft. It was nice, and they made half syringes, so it was convenient to use in small amounts. But I just wouldn't use it because of that late complication. I wouldn't want that.
Those lumps are not solvable. So that's the inflammatory nodules are not filler. They're actually your body's inflammation. You can't get rid of them.
You can treat them though. And if you can get rid of the nidus of filler that's causing it, then hopefully you can make that go away. But it's a way bigger deal to treat. You don't want to have that. That is it's an unnecessary complication, because if you don't use those Vicross fillers, then you won't have that problem. I've never seen that that particular complication. The other big thing is infection. So I've not ever seen actually an infection from filler in the lips ever. And I don't think that we've ever had an infection from filler, but I've definitely seen it in one patient who was treated with Bellafill and had a smoldering infection. The problem with Bellafill, because it's, a foreign body, it's plastic. Any foreign body can serve as a place for bacteria to grow. Bacteria tend to be kind of housed in these spaces if you've got foreign bodies inside. That's why, we have to be really careful if you've got some kind of implant in your body. We want to make sure it doesn't get infected. Well, any artificial filler, that it works the same way. I've saw a really bad smoldering skin infection after Bellafill in the past. Any other complications? I think the one other thing is way too big or too small. You're just unhappy with the way it looks. Right. That's possible. Too big, you can always dissolve some of it. Too small, you can always add more. But I think that gets back to having like kind of reasonable expectations about what it's going to feel like right after, what it's going to look like within the next few weeks. And then we try to work with people to just, come back, and we can touch it up. We can add some in the future, usually at least 2 weeks later.
Right. Because the swelling can make things look asymmetric. So you don't want to try to chase that too soon. I think realistic expectations is also super important. I'm always trying to set that up at the beginning, because sometimes we're all a little bit asymmetric. They say the sides of our faces are sisters, not twins, and so you're never going to be exactly symmetric. And sometimes you start to look at things just too closely, and you're just getting too nitpicky about the details of your face, which you can if you just don't want to look too close, because nobody else is looking that close except for maybe your injector. So,
well, I think what happens also is once we do a treatment, then people start staring at their faces a lot more, and then they're noticing things that, may have been there all along. And now it's bugging them because this other thing that we did, they're like happy with, and now a different thing's bothering them. And I do think that a lot of people notice asymmetries after having some kind of treatment with us.
Right.
Yeah.
They didn't know that was even there until they had the treatment, and then we look back and say, oh.
Yeah, that's why we always take pictures. It's not because we and both you and I feel very strongly about not like putting all our patients on Instagram. That's not what we do. But we always take pictures just to show, well, this is what you look like before, just so we know that, what it looks like after is from something that we did, and so we can judge our results over time. I think that's very important. So why does it matter who injects your lips? Because here we're two doctors, and we both, you have a nurse practitioner in your office, and I have a nurse practitioner and two PAs in my office. And we are probably up there with most anal injectors out there that I know of. I know you and your staff and me and my staff. I mean, we are very, very anal about this, and we have staff meetings, and we consult with each other, and we have continuing education, and we go to meetings, and we do continuing training. So why does it matter to go to someone like us rather than, someone who maybe didn't go to med school or nursing school? I just had a guest last week who's from Texas, where there are a lot of injectors in Texas who are practicing without any licensure at all. But even in our state, there are plenty of people who are practicing either without a license or outside the scope of their license. So do you have an opinion on that? Why does it matter?
Well, I think you just addressed it when you said how we're so anal about things. And I think as physicians and healthcare providers, we really are always focusing on kind of what are the worst case scenarios and how we deal with that, what trying to avoid complications and being able to deal with it when you're doing a surgery. What organs are you trying? What things are you trying to avoid injuring, and to get the best outcome, and avoiding things like infection and all these things that we just mentioned. So that's always on my mind when I'm doing any type of procedure, and then we have all of the things to treat those things, and we're constantly educating ourselves on what's the best way to deal with a vascular occlusion. So we have the hyaluronics, we have ultrasound. We would reach out and help each other in this situation as well. We have those sorts of resources.
We have the resources for sure to take care of any complication. And I'm not sure how those people with no license can even get the filler or the hyaluronics, because they can't legally order real filler in this country without being a doctor or, a nurse practitioner in some states. But so how do they have it in the fridge, or where are they getting it? Or maybe they're, they don't, and they just, tough noogies. If you have an occlusion, there's not anything I'm going to do about it. There was a practice in the Seattle area that I knew that routinely had occlusions with Bellafill. and there's nothing you can do about that. So, I don't know what they do, but if you have no medical resources, then you won't be able to access those when you need to treat a complication. So I think that's a really big part. I mean, obviously we can treat infections. We have, we can prescribe antibiotics for that, and we have access. I also, you mentioned ultrasound. So I have an ultrasound device in my office, and, as a recovering radiologist, I can say that that's the only ultrasound I ever use, is to take a look at things for my aesthetic practice. But ultrasound is a very, very critical tool if you did have a vascular occlusion. So you're able to target the treatment really well with ultrasound. And obviously you would need familiarity with ultrasound, which very few doctors even have, much less, lay people. So I think that's really, really important, having not only the knowledge and the access to all those things in the rare case of a complication. And I do want to stress that lip filler is very safe, and people are doing it all over the place. It's, millions and millions of people doing it. I'm not saying that vascular occlusion is likely, but it happens. It definitely happens. And it's frequent enough that you definitely want to make sure you go somewhere that they can actually treat it if it were to happen to you.
And I guess as providers, I'm very aware of the risk of a vascular occlusion. So my technique is always with that in mind. So I'm not just putting a whole bunch of filler really quickly into someone's lips. I'm going slowly. I aspirate. These are techniques that are designed specifically to avoid an occlusion. Not that it couldn't happen even in a perfectly injected lip, but reduce that chance.
Yeah, absolutely. And I've seen some videos of injections where I just can't believe how deep they are. Like, they're just lucky that they're not hitting something. So I think that's been really a great conversation, and that's a lot about filler. Hopefully we haven't left anything. I'm curious to know, because we're both in our 50s. I have no filler in my face. How about you? Do you have any filler in your lips, or?
I don't. Not yet.
Not yet. I know. I was thinking, because I still have pretty good volume, although I'm starting to get lip lines, which are those little vertical lines above the vermilion border, and I really don't like those. I've never ever in my life been a smoker, and I'm not, but I don't think I was particularly prone to it. But if you do treat the lip, actually, that will help a lot with those lip lines, because part of that is you lose volume in the lip. It's like, imagine if you take a balloon and you deflate it a bit and you look at the part where the knot is and you can see all those little lines. It's because the volume has been taken out of the balloon. If you were to pump that balloon up again, those lines go away, right? And so that would be the one thing. It's somewhat tempting to get a little tiny bit of filler just to treat those lip lines. But I haven't done it yet so far.
It's been on my to-do list as well. So we have to just get together.
Right. Anyway, well, thank you so much for being on the podcast today. I appreciate your input. And of course, I appreciate your partnership so much. And hopefully you'll come back sometime in the future for another conversation.
It was my pleasure. Thanks so much for having me.
If you have a question or a crazy story of your own that you'd like to hear on Med Spa Mayhem, contact us through our website, medspaamayhem.com, or check out our contact information in the liner notes. If you learned something today and like what we're doing, please give us a 5-star rating and read the book. Med Spa Mayhem is coming out June 11th, 2024. The link to pre-order is available on medspaamayhem.com. We hope this conversation has helped you get a handle on why lip filler is one of the most popular cosmetic procedures in the world, and why you might want to be careful about where you go for this procedure. For lots more information on lip filler, check out our website at glowspaseattle.com. This has been Med Spa Mayhem with Dr. Kate Dee. We are so grateful you're listening, and we hope you've learned at least one fun or possibly disturbing fact today. Don't forget to subscribe and leave us a 5-star review. Oh, and read the book. Med Spa Mayhem comes out June 2024. Available everywhere books are sold. You can pre-order now on Amazon, Barnes & Noble, and at bookshop.org. Links and more can be found on medspamayhem.com.